I use she, her, got it. I use she, her pronouns. I'm the communications and policy manager at Campaign for Southern Equality, and I live in Nashville, Tennessee. And I'll pass it back to Tian if you want to do an introduction.
Yeah, so I am Tian. My pronouns are they, them, and I am the advocacy coordinator for Intransitive. And we are based in Little Rock. Our community center is in Southwest Little Rock. And yeah, I will pass to Sarah.
Hi, I am Sarah Everett. I'm the policy director for the ACLU of Arkansas. And we are also based in Little Rock. And we have been lucky enough to get to be there with Intransitive and other amazing folks to work against these horrible things in the legislature and in the court. So I'm excited to chat with you all about that and happy to answer any questions. And I will pass it to Michael.
Hi, folks. I'm Michael Bennett Spears. I'm the pronouns he, him. I'm the program director for the Equality Crew here in Northwest Arkansas. We work with LGBTQ plus youth grades K through 12. And then also are lucky enough to get to collaborate with wonderful folks like Tian and Sarah with Intransitive and ACLU. So, and I am gonna pass it to Liz.
Hey guys, I'm Liz, pronounced she, her. I am mom of 5. One of my fabulous kids is Simon Garbett and is a trans youth and has forced me to be a fierce mama bear. And we've been traversing this landscape for many years now. And I'm just here to answer any questions I can and help, you know, with any support. Also, I'm a nurse, so I do have a little bit of a medical perspective, but whatever I can do to help.
Awesome. Thanks, y'all. I think next on the agenda, we have ACLU of Arkansas talking about litigation and possible outcomes.
Yes. So as you all probably know, in 2021, Arkansas passed the first ever statutory ban on gender affirming care for trans youth. And before it went into effect, we got it blocked in federal court. So the law has never gone into effect. And then we had a trial in, I think, October and November of last year, and got a very good decision on the full trial with all of the expert testimony and evidence presented to the federal court. He, of course, found in our favor and issued a permanent injunction blocking the law. So the law is not in effect right now, and care is available in Arkansas. Doesn't mean it's easy to find, but it is legal. And of course, moving forward, we know the state has already filed a notice of appeal. So this case will be going to the 8th Circuit, and it's hard to predict what will happen there. It is not a very friendly circuit, so it really could go either way. I am a little more on the optimistic side, but beyond that, either way, there will likely be an appeal to the Supreme Court. So really, this could take a year. It could take several years to fully resolve, assuming another case doesn't get to the Supreme Court before ours does. And then the sort of minimal risk in the meantime is that the 8th Circuit could issue a stay in the lower court's decision. The state asked for that when they appealed the preliminary injunction, and they didn't get it. I think they have a hard argument for getting a stay right now, but it could possibly happen. But like I said, for now, care is legal in Arkansas. The law that was passed this past session. You may have heard a little bit about it, and it's super complicated and confusing. I don't think the people who passed it even really understand it, but what it does is it creates a medical malpractice claim for someone who believes they've been injured by receiving gender-affirming health care as a minor. So I think what they're trying to do is create a cause of action for regret, which, as far as we know, in Arkansas, there has been no evidence of anyone ever receiving care as a minor regretting their decision. So doctors are still pretty safe to provide that care, and it doesn't outlaw any care. It just provides a cause of action if someone believes they're harmed. And this, I mean, this was really kind of an option before. Anyone can bring a lawsuit for medical malpractice or other torts, but this gives them maybe a little more of an avenue, and sometimes more, what's the word, maybe motivation for someone to do so. Again, I think the risk is minimal for doctors in Arkansas, especially if they're following the standards of care set out by WPATH. But that law is there. The bigger risk maybe that malpractice insurers, and this is really getting into the weeds probably, but malpractice insurers might decide to stop covering doctors, and that might pressure some into stopping care. But so far we have not seen that happening. That has not been threatened. So like I said, as of right now, gender-affirming care for trans youth in Arkansas is legal. There are, again, questions about availability that I think this is really meant to address. But I'm happy to answer any questions anyone has. I think we have Q&A at the end about legal issues.
Thank you so much, Sarah, for breaking down the really complicated legal situation in Arkansas. And of course, we'll have time for questions at the end about any of that. I'd love to pass it back to Intransitive for some insight and updates on their end.
I can't hear you. Oh, you can't hear anything. How about we juggle things around and we can go to you, Emma, and then while Tien figures this out.
Sure. Can you share my slides? Or do you want me to share? I can share my slides.
If you can share your slides, then I will touch base with Tien and figure out if I can be the tech whiz.
Amazing. Amazing plan.
Okay.
Oh, I think we can hear you again. No.
I couldn't hear anybody
Yes.
until now. I haven't been able to hear for the last few minutes.
Oh
Oh,
no.
no.
Yeah, sorry about that, y'all. I'm trying to, sorry, I don't know. Okay, let me see if this is gonna work.
Can y'all hear me?
Yeah.
Okay, now I can hear y'all again. Sorry about that. I don't know exactly what happened, but I haven't been able to hear for a few minutes. Anyway, I see I'm on the big screen. Is it my turn to talk about Intransitive now that I've
Yes. Yes. Sorry about that.
No, it's okay. We started our Defend Autonomy campaign last year, and Defend Autonomy was about cross-movement organizing. So we all know that the root of transphobia is the same thing as the root of racism. It all is racism. It's all white supremacy. And in order to collectively move forward with this movement, we have to join forces across all movements, right? Because trans justice is racial justice, is reproductive justice. It's all rooted in the same, and it's all the same fight. So we started Defend Autonomy last year and started organizing with folks all over the state. And it was that organization and the folks in part of our a part of our Queer Autonomy Coalition that got folks to the Capitol during the last legislative session, and actually in the 2021 one that Sarah mentioned earlier, getting people there, speaking up, speaking out. We trained folks to be able to tell their stories, and then we went in there and we told our stories, and we got bills. You didn't get them completely stopped and thrown in the trash, but we were able to get them gutted. And so that was with the help of our coalition partners. It was work that we all did together. And that's what we have been focusing on, is cross-movement organizing. Besides, and also our direct services and our daily life here at the center, we provide direct services such as interpretation, HIV testing. We do resource redistribution, and we have 6 different emergency support funds. So we do a whole lot. And yeah, we're just here to serve the trans community of Arkansas. And what we have been told by various people is that even though there are providers like in Central Arkansas, that people who are already established as patients, someplace like the Gender Spectrum Clinic at Children's, that if you're not a previously established patient, that it's really hard to get new appointments now. And I would like to ask Liz Garbett. Liz, could you speak on this for us for a minute from a experience, from your perspective as the mother of a fantastic, phenomenal trans teen, and also as a medical provider? Could you speak on if your sons and his peers if your son's peers have been able to access treatment, or if it feels like to them that things have come like kind of to a halt?
So, yeah. So after we spoke the other day, T and I did touch base with Simon, and that's actually exactly what is happening. So fortunately for Simon, for us, we were already, established at Arkansas Children's Hospital. And so we haven't had any personal struggles with that, but Simon has several friends that he reached out to, and they're having a very difficult time getting appointments. Or they're getting an appointment, but they're getting on the list, and it's a wait for months and months and months. And, I know of one particular kid who is having a hard time even getting I don't know, some insurances, I don't know if they require a referral or whatever, but it feels like, and I'm sorry, I'm switching my phone around, but I have to have it plugged in. So, is having a hard time getting a referral. I don't know if that's a thing, or that's what the parents took the kid to the PCP, and the PCP seems to be giving them a runaround. And I wonder, because that was my fear, when the law, and I don't want to hypothesize or scare people, but when this law about the lawsuit went into effect, as a nurse who works with surgeons every single day, their number one fear is a lawsuit. So I wonder if any of these sort of things where people are getting on lists or having to wait a long time for an appointment are where they're not necessarily being told outright that they can't get care, but that doctors are going to be afraid to give care for fear of lawsuits. So I don't know, but it's definitely slowing down. It feels like Simon, he can't be here tonight. He went to work, and then he's the section leader for his band. So he's at band practice doing way cooler stuff than us. Right. Than hanging out with the old folks. But he said that he has reached out to several of his friends that he's met through the advocacy work and whatever. And a lot of people that are newly coming out are having a really difficult time just getting appointments. And so I wonder what the correlation is.
I'm sure it's high. Also, Simon is way cooler than I am on any given day.
Right.
But yeah, I'm sure that is, I mean, like you just said, providers fearing lawsuits. And so they are like, this legislation is hitting in pocketbooks and creating fear. And I feel like that's exactly what it was intended to do, right?
Yes.
And to create this climate of fear, so that even providers who can legally provide gender affirming care are not doing so out of fear. So which means that, you know, the bills are working. So
Right.
thank you, Liz.
Yeah, thank you so much, Liz. Sending love to you and your son. Yeah, and just sort of jumping off what you were saying, you know, even though care is legal in Arkansas, obviously there are a lot of barriers. So we're going to be talking about STIAP in a minute, but I'd also like to say, if anyone has any sort of insight or advice or knowledge about providers who are taking new patients, please feel free to share that in the chat if you feel comfortable. This is a great space to sort of share that kind of stuff with our community, because we're all trying to figure that out right now. Yeah. But with that, I will share my screen. I have a couple of slides because I love slides. Yeah.
What about Michael and the equality crew?
Oh, am I skipping them? Were they supposed to go next?
You're not? I'm so sorry. Are you not?
No,
Ignore me, Emma. Ignore me, Emma. I apologize. I looked at
We
my
will
agenda
get, we will
incorrectly.
definitely not skip Michael.
No, I totally looked at my agenda wrong, y'all. That is all on me. It's
No,
not
you're
Emma's
good.
fault.
All right. Yeah, so I'm super excited to talk to y'all about the Southern Trans Youth Emergency Project. It's a project that Campaign for Southern Equality started at the beginning of this year in Mississippi, and since then we've expanded to provide services in every Southern state as these laws have continued passing. Yeah, and we're very excited to be working on this project in Arkansas with Intransitive. Yeah, so the project was really started just to be able to ensure that trans kids in the South are able to continue their care no matter where they're living. As many of you know, 80% of trans youth in the South are currently living in states where an anti-trans healthcare ban has passed. So this program has been really crucial in just providing a little bit of support and enabling those kids to continue getting the care that they need. So STIAP provides care in a couple different ways. Firstly, we're aiming to provide information and support. So that just looks like clear, accessible information and updates about the status and content of gender-affirming care bans and how to initiate care. So that's, basically what we're doing right now, just trying to get everyone on the same page about what the situation is in each state, because there are similar laws, but they're all a little bit different, and providers all handle it a little bit different, and it's incredibly confusing. So yes, that's a big aim of the project. Secondly, we're doing patient navigation. So that looks like making sure that trans kids and their families can access referrals to gender-affirming care providers in states without bans, and also information about mental health resources and community groups. And then finally, we have emergency assistance grants. So these are direct grants given directly to families of $500 to assist with any of their immediate needs. So that could be travel to their care, even if, a family's getting care within state in Arkansas, if they have to travel really far to get their care, they would probably need some help with that. Or it could just be used for like some sort of a self-care thing, like getting a nice meal for your family, hopefully not a $500. Hopefully you're not having to do that, but there's basically what I'm trying to say is there aren't any restrictions on what people use it for. It's a trust-based grant, so it's given to the family to use for whatever they need during the time when they're facing barriers to care. Okay. So this is basically reiterating what I said previously, but really just want to make it clear that these grants can be given to any parent, guardian, or caregiver of a trans youth. We can't give the grants directly to youth. That has to be given to somebody over the age of 18. And then how to access these resources. All of the resources can be accessed for Arkansas families by going to southernequality.org/AR resources with another slash. So yes, please check that out. And yeah, so what happens after you reach out? So after you fill out that form on the website, you'll receive an email from a member of our staff asking a time to set up a phone call with you. And then during that call, our staff will work with you to determine what resources your family's interested in and how we can connect you. So we can connect you with any or all of these resources depending on your needs. We can see if you're eligible for a grant. We can talk to you about what the best option would be for your family when it comes to referring you to gender-affirming care. Yeah, and then we can also connect you to other organizations in Arkansas that are providing support.
Hey, Sarah.
Sorry.
Hey, can I add something
Oh,
that
sure.
I just thought of, just on a personal level? So I'm a mom of 5, and because of our income, our children, all 5 of them, qualify for our kids. And up until just in the last month or so, all of Simon's care, thank you, Lovey. All of Simon's care has been paid for on our kids, except for the actual prescriptions. Like, we were paying out of pocket, and we're fortunate enough to be able to do that. However, I noticed I have started getting bills now for his lab work. And so I wonder how, like, previously I did not. But now I'm getting bills for his lab work, like for, checking different levels and all of his endocrine stuff. So I just had that thought. I'm starting to wonder about that. So I wondered if there are parents out there that are paying out of pocket for things that have not been covered, that grant might be applicable to that. So
yeah, for sure. Yeah, that's a great point. And that's exactly like what our patient navigators are ready to talk through with folks. Yeah, because there is a lot of different unique situations that are happening. And I think that'd also be a great thing to talk about in the Q&A, if anyone else has had experiences like that. Yeah, and that pretty much concludes my overview of STIAP. Again, you can find all of those resources and access the resources at southernequality.org/AR resources. And then we also have a resource guide in Arkansas that anyone can read and share. It's a Google Doc that you can access with this link. Yeah, and that just sort of goes over an overview of the laws in Arkansas and also an overview of the STIAP resources. So yeah. Thank you. And now we will pass back to, I believe, Michael is next.
Yes. Thank you, Emma.
Yeah.
Thank you, Emma. And also thank you, Tien, for being ready to be like, hey, you skipped Michael.
I got your back, friend. That was on me, though. Emma was not doing anything wrong.
Oh, no, I was just sitting here giggling.
Yeah, same.
So,
Thank you for being here.
Yeah, thank you for inviting us once again. Huge appreciation to Tien for inviting us, and to Adam and Emma for helping make sure this happens. I think it's really important information. As I had said, I work with the Equality Crew. We're based in Northwest Arkansas, primarily serving Washington and Benton counties. Our experience has kind of been very similar to what others have said in terms of gender-affirming healthcare post-2021. We saw in Northwest Arkansas, I want to say it was in May of 2021, when they shut down the Gender Spectrum Clinic. And this was before it ever went into even possibly law kind of thing, it was just in the beginning stages of it. And that led to a lot of families of trans kids scrambling to get healthcare. And pretty much it all landed on one clinic here in Northwest Arkansas that is now has such a heavy caseload that the last time I checked, they're not even doing a wait list anymore. They're just like, no new patients. We can't do it. And I have been working for the last few months trying to identify other gender affirming healthcare providers. And what I am hearing time and time again is they exist, but they do not want to publicly talk about it. Which kind of plays into that same thing of if you were already a patient, you can get the care. If you are a new patient, it sounds terrible, but good luck, kind of thing. And you just are kind of out here kind of shooting darts into the dark and hoping you hit the right target. And I think a lot of that does relay back to an increasingly hostile environment they're seeing in this legislation. And certainly this kind of malpractice lawsuit is not helping, kind of thing. And I kind of agree that I think of what they may be looking at, and this is what I've heard from some doctors' offices, is there is concern about increased malpractice insurance costs in the face of this. I won't go into a whole spiel of opinions on this, but pretty much, yeah, it is. I wish I had something better to say than access to gender affirming healthcare in Northwest Arkansas is no better than it is anywhere else, kind of thing. I have a few of the kids in our programs go to the clinic that managed to get in before it shut down on receiving new patients. And then I've got a few that already are going out of state to get gender affirming healthcare. Outside of that, it's a tricky situation up here. I wish I could say that I saw other things rising on the horizon to kind of fill this gap. I am not. But if anybody hears of anything, please feel free to reach out and email me and let me know, kind of thing, and if I hear of anything, obviously I'll be letting people know as well. But beyond that, as far as what we're doing at the Equality Crew is we can still ensure that they have access to mental health care. And that's kind of our approach in this is we can't close that gap on receiving, HRT and all of the medical things you need there, but we can make sure that you have access to a therapist to process those emotions, that you have access to a safe space with supportive people, etc. And that's one thing, that's one of the reasons we started our affirming therapist database, which you can find on our website, that currently hosts, I want to say, around 50 therapists located in Northwest Arkansas. And what's really cool about that is it kind of cuts out the guessing work, because we did our LGBTQ plus youth needs assessment in 2022, which you can also find on our website. And one of the major reasons that these youth aren't accessing mental health care is a fear of having an unaffirming therapist, which is the last thing you want to face when you're already in a state of mental health crisis. So with this one, they can go in, break it down by location, modality, insurance accepted. Do they do telehealth? Do they offer sliding pay scale, et cetera, et cetera. And so that's, oh, thank you, Adam. And so that's really kind of where we're leaning into on that one is, and anytime I talk to the kids, I tell them, look, there are a lot of things outside of our control happening outside this room, quite frankly. If I could control the Arkansas legislature, I would need to be a much richer man. I said it. But as long as you are within our walls, we can ensure you are safe. And so that's where we go. And I can tell you firsthand, I have had conversations with these kids that providing those safe spaces saved lives, plain and simple. And that's what I would encourage anybody on this call, any organization that's trying to figure out what to do, any parent that's on here going, how do I support my kid? Provide them safe spaces, recognize their chosen name, recognize their pronouns, You know, I have some kids that I'm having very frank conversations with and saying, I don't know how to get you this medical care, but I can ensure you are safe until you are 18 years old. And this mess doesn't apply to you, and you can either get the care here in Arkansas or you can get elsewhere. And in the meantime, we connect them with places like the STIAP program and such that helps them get care outside of the state. But that is pretty much kind of my general ramble on that. You know, beyond that, we offer our affirming teacher and school staff database, which helps to connect students with affirming teachers and school staff in their school. The way that works is they can reach out to us and say, I'm going to this junior high and this grade. Are there any teachers that have self-certified with y'all as affirming? I go through the database and look and send them that contact information. We put it completely in the hands of the parent/child to contact the teacher. That way, we are not identifying those students to the teachers. It's completely in their control. Flip side of that, that database is completely private so that the teachers and school staff's information is also protected and they don't risk being exposed. That is one that is also becoming more and more complicated with this legislation that we're seeing. I'd also throw out there that I know some folks ask, you know, what's the best way to support their kids in the schools right now? I would recommend, we've got our back to school guide on our website that has a whole host of things. Genderspectrum.org has an entire gender affirming support plan that you can fill out on their website, print out, take to the school and sit down with the administrators and say, I'll get back to the question, but and sit down with the administrator and say, okay, here is our agreement. Here's our memorandum of understanding on how you will take care of my child. A lot of the kids are discussing the recent law that went into effect that school staff are not required to recognize their pronouns. But if a parent writes a letter, gets it notarized, takes it to the school and says, I am aware that this is the case, et cetera, et cetera, et cetera, but these are the pronouns to be recognized, then that is something they can put into place. And I'll add that, I see in the chat, I'll add the link to that gender support plan over there. And the Liz, the affirming teacher database is actually statewide. Currently, the therapist database is only Northwest Arkansas, but I am getting more and more requests to expand it, and most likely will be soon. If I find a magical way to make an affirming medical provider database happen, which is what I am working on at the moment, I will. I suspect probably our work on is it'll work very similarly to the teacher database, where it's kind of one of those things where we're not just putting the information out there on the website. We keep it stored within our kind of hidden databases, and you can reach out to us and say, hey, I live in this city. Do you know anybody nearby? That one's a little bit more in the works. So, and then beyond that, we just have fun events. If you are in Northwest Arkansas, come to our Ice Cream and Icebreaker Social on August 12th from 1 to 3 p.m. It's an open community drop-in event, and it's kind of our once a year open doors. Anybody who wants to know about us and kind of see us in action can drop in. Otherwise, the majority of our events are registration required, location provided upon registration only, for security reasons, obviously. So, but that is my general ramble, and I will quit taking up time. Thank y'all for listening to me, though, and I appreciate you being here.
Thank you, Michael, and thank you for all of the work y'all are doing in Northwest and for all the work you're doing statewide. And yeah, to know that kiddos there have safe spaces and that y'all are doing everything you can to create the safest places and spaces possible it makes my heart happy. I know how hard it all is, and also to knowing that there are spots for refuge and comfort. And also I'd like to share that we are also having a back to school event. Ours is on August 19th. But if you are the parent of a trans youth and you would like to sign up for, it's going to be backpacks and school supplies. And we're going to have a clothing swap here at the center. I can see if you, the link, it's on our website, but also I can put the link in the chat later too. Just want to tag that one off because you inspired me to tell about that, Michael.
Thank you all so much. My heart is also happy hearing about y'all just doing everything possible to support trans youth in Arkansas. Super great to hear about everything that y'all are doing. Yeah, I'd love to pivot to our question and answer. So my plan is to sort of alternate between questions that were submitted in the chat and questions that people are raising verbally. And since we're a pretty small group, I'm sure that we'll be able to do that or get through most of the questions. Would anyone like to pop on their mic and get us going with a question?
Sorry, before we do that, let me just stop the recording. And I'll just share that if you have anything